Hey guys, let's look at this new study that just came out that talks about your risk of developing an autoimmune or connective tissue type of disease after getting a COVID infection. So we know that having a COVID infection involves lots of inflammation. COVID really turns on our immune system, and in some cases the immune system is turned on so much that it starts attacking our own body, our own healthy cells, and that's called autoimmune disease. We know that there are many autoimmune conditions like rheumatoid arthritis, lupus, Sjogren's, other conditions under the umbrella term connective tissue diseases or vasculitis. So what they tried to figure out in this study is after a COVID infection, do you have a higher chance of actually developing one of these autoimmune conditions because your immune system is sort of turned on by the viral infection? So it's a massive study. They started with over 10 million people in Korea, over 12 million people in Japan. These are large databases. They looked for the people who had had a COVID infection, who had had a flu infection, or who had had neither infection. And what they figured out was that in the first year after your infection, if you had a COVID infection compared to no infection, you had about a 25% higher chance of being diagnosed with one of these inflammatory autoimmune type conditions. And if you had a COVID infection compared to a flu infection, you had about a 30% higher chance of having one of these diagnoses. So it isn't just any virus, it seems to be the virus that causes COVID, much more so than a virus, let's say, like the flu. So those are pretty scary numbers considering how many people have had COVID disease. But based on the timelines of this study, the people in the study would have had either the original virus or the Delta variant of the virus, whereas most people ended up getting Omicron. We don't know if this happens with Omicron, to what extent it happens with Omicron. We also don't know if it happens with repeated infections, and maybe the chances are even higher with repeated infections. The other important thing about the study is that the risk was there in the first year after the infection, but it seems to have disappeared after that first year. So that first year is the toughest, the most important to get through. But if you get through that first year, your risk goes back to normal after that first year. And the other thing was that if you had been vaccinated, if you had at least 2 shots of the vaccine, your risk was actually 60% lower of having one of these conditions compared to people who got COVID but had not been vaccinated. And your risk, in fact, went back to that of the normal population who had not been infected. So it also shows that the vaccine seems to reduce your chances of these kinds of complications, which is sort of in line with what we've seen with other studies looking at these kinds of perhaps long COVID complications, where the vaccine reduces the severity of the infection, and because more severe infection is associated with these kinds of complications, the vaccine is associated with less of these kinds of complications. So we are at a point in the pandemic where most people have had the virus or the vaccine or both, and if you're healthy, it means if you get the virus, you're unlikely to get very sick from it. But as we learn more and more about long COVID, which is sort of the umbrella term for all these kinds of long-term complications, we know that people even with mild infections can get these kinds of complications. And quite consistently across these studies, what we're learning is that vaccination seems to reduce your chances of getting this. So aside from having a less severe infection when you get COVID and a less long, prolonged infection, here's another good reason, in addition to many other studies that show that you are less likely to have these long-term complications. In this case, less likely to develop a complication in the form of autoimmune disease or joint disease, or in that family of connective tissue disease.